Hey, so we've all been brainwashed into this idea that traditional insurance is the best way of accessing healthcare. And I'm here to tell you that's not always true. There is a type of practice called a direct primary care practice that might actually do better for a lot of people. I'm Dr. Leslie McElrath. I'm a board certified family physician. I'm located in Akron, Ohio, and direct primary care is how I run my business, Monarch Ideal Care. Direct primary care is this idea that we get rid of insurance interference when it comes to primary care services. Now, am I saying that traditional insurance is not necessary and you shouldn't have insurance? Absolutely not. There are certain things that my skill set does not cover, and once we get into the really expensive things, medical insurance should be utilized. It helps you pay for things without it being an untoward burden and messing up your credit score and all of those things that should not happen, but we live in America, so whatever. But direct primary care is this idea that you pay your doctor directly. It's sort of like a gym membership. So it's on a subscription. So every month you're paying and you get the services that that doctor provides. So every direct primary care office is different. There's not a one size fits all situation when it comes to direct primary care. Like, I don't do anything that has to do with feet because I think feet are gross. That's my personal pet peeve. But I've known direct primary care doctors that deliver babies, that see patients in hospitals, that do geriatrics. Like, there's so many different types of direct primary care doctors because it's based upon what the doctor finds interesting and what the community that that doctor lives in actually needs. Your doctor is back to being that person that you see all the time, that same person every single time. You know, you don't have that concern of them pushing you out of the door really quickly or asking questions that have absolutely nothing to do with what you're doing there, because a lot of that unnecessary stuff is because of insurance. The insurance has requirements to prove that you're doing the things that you're saying that you're doing, that prove that we're holding ourselves up to a certain rubric. And so I'm not saying that insurance is bad. It's just not always the best fit for everybody. That's all I'm saying. Direct primary care is a viable option for those that don't have access to traditional insurance, want greater access to their provider, or just don't want their insurance in their business. Like, sometimes that's a legit thing. Like, you don't want your insurance company to know that you have a particular condition. And most doctors that work under a direct primary care model tend to try to really think about how can we save you money. So I always work with not insurance companies, labs, to get you the best prices available, looking at the prices of the medications that I'm recommending. We're doing this so that, because I actually have to worry about your finances, because direct primary care payments are different than insurance payments, which usually come out of your check before you see them. So this kind of out of sight, out of mind. You never have to think about it. Direct primary care payments are something that you have to personally decide, I can budget this into my life and I want to spend this money. If your health is important to you and having that added access to your doctor is something that you desire, look for a direct primary care practice. Check it out, try it out, see if it's a better fit for you than a doctor's office where you feel like you're a number on a file, because you're not. You're a human being that deserves to be treated like a human being that is cared for. So check out direct primary care. The way to find out one near you is a website called dpcfrontier.com. But otherwise, this is Dr. Leslie saying peace.